Welcome to Hearing What Matters, a podcast for Australians looking to know more about their hearing health, hearing loss and hearing aids. My name is V. Tran, host of your podcast. I do work for Active Audiology, an independent clinic in Melbourne, and my purpose with this podcast is to deliver information that is controversial, independent, honest, for those looking to improve their hearing health knowledge and make informed decisions. Have you ever experienced ringing, buzzing, or humming in your ears that just won't go away? That might be tinnitus, and it's a condition that affects 1 in 4 people over the age of 60. And today we're going to talk about what you can do about it. We're joined by Julia, one of our audiologists at Active Audiology, and she's going to break down for us what we need to know. And if you've experienced it or you know someone, this episode is going to help you deal with that condition and explore ways to manage it. Julia, welcome back.
Thank you.
So what exactly is tinnitus and how common is it amongst people of different ages?
So tinnitus is the perception of sound internally. It can be ringing, it can be buzzing, it can be a rushing noise. Some people even hear music. It's a sound that's generated inside. In very rare cases, it can be heard externally, but most of the time it's a noise that's only heard by you. Yeah, in the absence of sound around you.
What are the causes?
Anything that affects the ears can cause tinnitus. So that could mean wax blockage. It could mean you've had a cold and you've got congestion. It might be that you've got a hearing loss or the very beginnings of a hearing loss. And other things that I guess not thought of as commonly can be things to do with the jaw joint, neck pain, arthritis, and some medications can also cause it.
And why do some people get it but not others?
All of us, I think it's normal to get that occasional, you might hear that occasional ping or ring, which just can show there's a bit of fatigue with your ears. I guess for those reasons we've just discussed, some people can experience it when others don't, if there is an issue with the ear system somewhere along the line. The way you react to it can also influence whether it becomes an ongoing issue or if it's just something fleeting that comes and goes.
And there's nothing wrong with my brain, is there? Like I'm not going crazy when I start hearing these
Absolutely
noises.
No. But there can be other health causes, as I said, along the hearing system that need to be investigated. Yeah. But I think what you mean is it a psychological thing? And the answer is no. It's something that really is there, that is being generated. Nobody fully understands why as of yet, but it's something that's constantly being investigated.
Like I won't get it a lot, but what if I go to like a loud music concert or I've been out where it's really noisy and then it's really profoundly like ringing in my ear at night time when I'm trying to sleep? Why does that happen?
Yeah, so when you're exposed to loud noise, that actually does cause fatigue of the inner ear. We've got tiny little hair cells in our inner ear, and loud noise actually affects their configuration, I guess you could say. So that noise exposure and then the ringing that follows is a sign that you've done something that probably wasn't great for the health of your ears.
Right. Is it permanent damage?
It generally not, but it can be for some people. But generally, it's just a sign that you have put your ears through that fatigue, and then they recover again.
Okay.
Yeah.
And so, how do you see tinnitus affecting someone's daily life? And what are they? Someone who suffers it chronically or regularly, what do they face?
It can be really debilitating for people. So there's a proportion of people where it's just a mild bother and they accept that it's there and it's just becomes a background noise. But there are others where it's really debilitating. So it can cause anxiety and depression because it's so frustrating hearing this noise constantly. And they'll find even that it becomes so loud that it's interrupting their communication. They feel like they can't focus or concentrate because they can just hear this noise all the time. A big impact it has is on sleep. So when you go to sleep, it's obviously a very quiet environment. So there's not a lot of sound coming in from the outside, and you start to focus in on the tinnitus. It becomes difficult to fall asleep. And other people actually experience interrupted sleep, so they'll wake up in the night and then hear the tinnitus and then it can't go back to sleep.
Wow, that sounds awful. How often do you see these severe cases?
They're not the majority. I would say it's probably 2% of people with tinnitus would have that severe level, or they might start at that level but over time learn to adapt and progress to a different stage, a stage of acceptance.
And what do you do about it? What are the strategies? Do hearing aids play a role? Does therapy of some sort play a role? What can you do?
So with a tinnitus, I find in the beginning there is that panic sort of stage where you think, I'm never going to get rid of this. What's happening? Do I have a brain tumour? Am I mentally ill? Why am I hearing these noises? So the first phase for me, I think, is always understanding, having a hearing assessment, talking to an audiologist about potential causes so that you can firstly rule out all those sinister causes.
What would be the sinister causes?
I guess what your doctor will be looking for is something called an acoustic neuroma, which would be a tumour on the nerve.
Oh, gosh.
Yeah, but that's extremely rare. But once that's ruled out, then I guess you move into a different category where it's looking at your hearing levels, the overall health of your ears, and then acceptance and counselling around the tinnitus. So one of the biggest theories around tinnitus is that you can get into this cycle of distress where your brain, when you first hear the tinnitus, as I said, you panic, you're really concerned that there's something wrong. And what our brain is really clever, it will start to now place importance on that sound. So you'll be looking for it. You'll be listening. Is it loud? Is it soft? Is it high-pitched? Is it low-pitched? And by seeking it out, you get into this cycle where it actually exacerbates it. And then, of course, it does become more intrusive.
That is not helpful.
No, it's a little bit difficult to understand, but it's a bit like if you think about someone that lives near a train line and when they first move in, they're not going to be able to sleep because every night they hear that train. But over time, their brain learns that train's not for me, it's not important to me. So it doesn't listen for it, it doesn't tune in. You want to get to that same stage with the tinnitus where that noise is there, but it's of no significance. It's not a sound you need to be focusing on.
So you're saying that once you've ruled out a cancer, a brain tumour, then it's about learning how to ignore it.
Yes, and it's about adapting, and there's various methods and ways to do that.
Can I do them at home myself?
Yeah, absolutely. So what we recommend is the use of certain apps that will have masking sounds, and they're sounds that you can play at nighttime when you're lying down to go to sleep, or when you're just sitting reading a book and there's no sound around you, because the tinnitus does tend to be louder when there's no sound. And you'll find a sound that is useful for you. It might be cicadas, it might be water running. It really depends on the type of tinnitus that you have, and you just play that at a very low level to take your brain away from that internal noise. So that's one way. For people with hearing loss, and a large majority of people with tinnitus have some degree of hearing loss, we do find that hearing aids make a huge difference. Because again, you're getting a lot more external sound from the environment. You're getting that stimulation on the hearing pathways that you should have. And so you stop hearing these internal noises as often or as loudly as you once did.
So by giving me more sound,
yeah,
I'm almost focused on that and not the tinnitus.
Yes, yeah.
Right.
And there's other ways you can do that too. It's called sound enrichment. So the worst thing for tinnitus is silence. And they've found that if someone is in silence, you can even induce tinnitus. So sound enrichment through playing music or a musical instrument, things that, again, keep the hearing stimulated, will help you with that tinnitus.
At one point, or how bad does it need to get for me to consider hearing aids?
I think if you've tried, and there's other things you can do like relaxation strategies and meditation, breathing exercises. Let's say you've tried all of that, you've tried some of the masking techniques that I just talked about, but it's really, you're still feeling anxious and depressed and you're just not progressing. It's there most of the day, it's not going away. Then even with normal hearing, some people do get hearing aids to help with the tinnitus. Yeah. You can think of it rather than a hearing aid as a tinnitus aid.
Right. So is this a hearing problem? Is it a psychological problem? Is it a counselling problem? Who should I be seeing when I start getting this ringing noise and it's bothering me?
The first step is to talk to your GP, and generally they will send you to an audiologist to have a hearing assessment and to look at all that hearing pathway. That's the first step. And they might also send you for some other medical tests, depending on the type of tinnitus and what you're describing. Once you've done that, you can also see a psychologist, because cognitive behavioural therapy can help with tinnitus, with the adaptation process, but the audiologist can also help with that as well. Yeah. I would also say there's some really good support groups. So Tinnitus Association of Victoria, obviously in Victoria, and New South Wales has one too. I'm sure the other states might, but their websites have got really reliable resources. They've got factual information. You can get into a real Google rabbit hole with tinnitus, and there's a lot of false promises out there, unfortunately. But I find that the tinnitus associations have got, for example, people's experiences where they do talk about their journey with tinnitus that can be really helpful.
It'd be great to share those resources on our podcast. Also, the links to the apps that you were talking about for our listeners.
Definitely.
Would you share perhaps what you've seen someone who had mild to moderate tinnitus, and then how they successfully manage their symptoms?
Yeah, so as I said, the first step, I had someone who was working in construction, who'd been in demolition sites, a lot of really high noise exposure. So there were a lot of things to address. One was hearing protection to prevent that high dose of noise exposure. And the other was to use the apps for a period of time and then monitor the progress with questionnaires and things like that to check how impactful the tinnitus was down the track. So I did find in the beginning he was in that sort of panic phase where it was really intrusive and disturbing his life. But through that counselling process and ruling out some of those other causes and talking about how it's not a threat, he could move through that. And then with the use of the relaxation exercises and the masking noises on the app, within 6 months it had reduced significantly, and also using the plugs at work.
So he was a young gentleman?
Yeah.
And not necessarily an older person?
No.
Did he wear hearing aids or get hearing aids?
No, he didn't need to. He didn't. He had normal hearing, and he didn't reach that sort of phase where we couldn't improve the situation. It became something that was a part of his everyday life that he could manage without, losing sleep and things like that.
It's interesting because it affects anybody and everyone, really, and whether you've got a hearing loss or not. Yeah,
and some people, you may never entirely get rid of that sound that's there.
Is there medication for it?
Not really. They haven't been able to have any, success with that as of yet. You can try things like easing off caffeine, easing off alcohol, things that affect blood flow, I guess, can affect the ears. But again, that is very variable between individuals. Yeah.
So if I'm sitting at home and my tinnitus has been bothering me on and off, but at night time it's bothering my sleep, and I'm otherwise healthy, young, what would you say to encourage them to take the first step?
I would say just you've got nothing to lose by exploring it and just checking the health of your ears. And you might learn some information on how you can cope with it better so that it's not this mysterious thing that's always present. Yeah.
Julia, thank you. Tinnitus is such a misunderstood condition, and it can send people, like you've mentioned, into this state of distress. And I appreciate how you've broken it down to, well, obviously there could be things that are serious, which we need to eliminate, but it is a very manageable condition from what you say, and it does take some time. But one of the great things to hear is that there's not fundamentally anything wrong with your brain.
Yeah, it's something that is quite normal in that it's extremely common, and it's just a matter of using strategies to manage it so you don't get to that next level where it is really intrusive. Yeah, but there are definitely audiologists that run programs and things like that for tinnitus, so it's something that to look into if you're really struggling with it. Do seek help. Yeah.
Great. Thank you so much for your time.
Okay.